Good afternoon, Brandon Family Foundation. I'm David Stevenson. I'm the mission interpreter of the Bolivia-Oklahoma Methodist IU, or Methodist Partnership. I just wanted to give you a report of the medical work of the Methodist Church that you all have been supporting. We've had a lot of changes, a lot of things have happened the last 2 months, and I wanted to give you a report on that. I'm actually dividing this up into different sections so that you can skip forward or back covering the sections that you want to do. First thing I wanted to talk to you about is how great it was to have Nancy down in Bolivia with me for a week in April. I nearly killed her the first 2 days with exhaustion, picking her straight up to the airport at 4 or 5 in the morning and taking her out to Copique and taking her on these treacherous roads. But once she got past those first 2 days, she did great, and I think she had a really good experience. The nurses told me how great the training was that she did. She did some training on how to reduce hemorrhaging during childbirth. Not being a doctor or a nurse and being a male, I didn't stay for the training. I didn't want to see all that stuff. And they laughed a lot about that, but she had a great time, and I think she got a really good feel for the Bolivian reality and how it was significantly different than anything she'd experienced before. And I think she has a good idea of the work of the nurses and the work of the Methodist Church and of our health clinics. So I'm sure she'll give you a report on that. We do hope that she will return. I think it's good for the foundation to stay in contact with the work that we're doing, for her to see the progress going on in the clinics. And also, they look forward to additional training from her. Second thing I want to talk to you about is that about 2 weeks before I headed to Bolivia in April, I found out that the nurses have not been paid for about 6 months. And they were way behind in paying for these nurses' salaries. It's really remarkable to think of that they haven't been paid. These nurses live in remote communities, far away from any kind of social life. They're 20-something-year-old women, most of them, young women. They have as many as 1,000 people that they're responsible for the health care of, the sole responsibility for 1,000 people. They have no internet, no telephone, no social life. They live in a room that's attached to the clinic in most cases. In one case, they actually live and sleep in the reception area, clean the reception area out, put their bed down, sleep at night, put their stuff up, and do it every day. They're the only nurse there, so there's no backup. So that means that if they're not in the clinic, there's no one to provide health care for this community, for these communities. And so they very seldom leave. They're usually not gone more than 10 or 12 days an entire year. And now I found out they're not being paid. It's pretty remarkable. How we got into this mess was that about 20 years ago there was a nonprofit that started out of the Methodist Church called Andean Rural Health. It was started by the son of Methodist missionaries from the United States who stayed and married a Bolivian and stayed in Bolivia. And they had a joint general advance special where through the United Methodist Church, and got most of their funding from Methodist churches. But the deal was that they would split that money about 50-50 with the church. And they were receiving about $60,000 a year, so the church's portion of that was about $30,000, which covered all of the salaries of the nurses. This worked really well for about 20 years. But about 3 or 4 years ago, something happened, and I'm not really certain what, but something happened inside of Andean Rural Health. And some kind of conflict or something. I've tried to find out what it was, but I just haven't been able to. But the giving dropped from $60,000 to about $6,000 a year. And that meant the church's portion went from $30,000 to about $3,000. And this was about 3 years ago. The church used general funds to kind of make up the difference, thinking that this was going to be a temporary dip. But it's now been going on 3 years. There's no indication that it's going to change. So the churches cannot continue to support it, and so consequently the nurses' salaries have gotten farther and farther behind. I asked Laura, who is the nurse out at Kanani now, and I was talking to her, and I said, well, how are you getting by? She says, well, Pastor, she said, I borrowed money from my friends and family, and said, and a lot of people in the community are bringing me food, and that's how I get by. I said, but Laura, it's been 2 years you've been running behind and everything. I said, why do you still work for us? She looked at me kind of quizzically and said, Pastor, I'm trained to do this. And if I don't take care of these people, they'll die. Of course I'm going to work. I trust that the church will find the money. Pretty remarkable. I asked another nurse, Claudina, the same question, and she said that about 3 months ago she'd finally had enough. She decided she was going to quit. She thought about it, she prayed about it. She decided she was going to quit. No more than she made that decision, then a patient came into her clinic with a severe cut, bleeding. She stitched him up, gave him some pain medicine, realized that this guy probably would have died if she hadn't been there. As soon as he walked out the door, she decided she wasn't going to quit. It was too important. That's the quality of nurses that we support. And this is how we got into the situation. As soon as I found out about the problem, I decided that we needed to start on a long-range solution first. So we met with the Helicata. That's the leaders, the Oklahoma Methodists, the 7 or 8 people here in Oklahoma that are kind of my primary organizing group, which includes Dr. Thompson and others, and Dr. Crawley over in Stillwater, and the medical commission that we have. And we began to think about it, and we came up with a plan that we think is a really pretty good long-term solution. We're going to approach the Bolivian government to pay for the salaries for the nurses that are out beyond the reach of the government. 6 of our 7 clinics are beyond where the government has a program, and we think that we will be able to go to the government and ask them to pay for the salaries. We have a history of doing that with teachers, and it's been very successful. We have 14 different schools across the country, and the education ministry of the government will pay their salaries and really don't interfere in hiring or in what they teach or those kinds of things. So we think we can work out the same kind of a thing with the Ministry of Health. The only thing is it's going to take a while. Nothing in Bolivia happens very fast, and it's going to take at least a year to 2 years before we really get that in place. The second part, but that still leaves some additional costs, and the second part of our long-range plan is that we're going to approach all of the volunteers and mission medical teams that go and work in these clinics. While they're still there, as they're getting ready to leave, we're going to challenge them to raise $2,500 for salaries, the equivalent of a salary, a 1-year salary for one of these nurses. The nurses make less than around $200 a month. And we're going to challenge each one of these medical teams to raise $2,500 when they go home. They've just been with the nurse. They've had that excitement. They know the hard working of the nurse, how hard the nurse works, and they've seen how they live, and we think it's going to work. We tried this first with Stillwater team when I was down there in April. They were getting ready to leave. I asked them about this. I just found out this week they've agreed to raise $2,500 this year. So I think this is going to work. So that's the long-term solution, a combination of getting support from the government and contacting VIM teams and asking them to help. We're going to increase the number of VIM teams so that we can have at least one team in every medical clinic by 2014. So I'm pretty convinced that by 2014 we will have a long-term solution in place. So now the question is, how do we get from February 1st of 2012 to the end of 2013? The nurses have been paid through January of 2012. And so we need to pay for most of this year and all of next year. The Brannins money that was given in December of 2011 was received in January of 2012, and with that money they were able to pay and get the nurses caught up all the way through the end of January. So that's in pretty good shape. What we anticipate over the next couple of years, in 2012 and 2013, is that with a little help from the Indian Rural Health, the $3,000 or $4,000 we get from them, and the money that we raise through the from other sources for salaries through the Advanced Special 08767A, we ought to be able to raise a significant amount. And then we're hoping to raise about $5,000 from the 2 VIM teams that are going. But we're still going to be short. So I was able to get a $10,000 grant from the United Methodist Committee on Relief, and that money's on its way. And had good indications that I'll be able to get another $10,000 grant in 2013. And then I've applied for a $25,000 grant from the Oklahoma Conference Board of Missions, or it's called MSMT. And I have really good indications that we're going to get that money. We should find out in the next 4 or 5 days. I should know for sure. And if we can get that $25,000, the $10,000 from Corps this year, $10,000 from Corps next year, with the other resources, we should be fine through 2013. So I believe pretty confidently that we are going to be able to cover all of the salaries from where we owe them now, all the way through into the foreseeable future, without having to use any Brannins family money. You guys are still kind of my backup if something falls through, or if something we don't do quite as well as we think. But I'm pretty confident that we are not going to have to use any Brannins Family Foundation money for salaries in the foreseeable future. Another thing that came up when Nancy and I were in Bolivia has to do with the development of a women's and children's specialty clinic in El Alto. As you know, we've had a clinic in El Alto. In the last year or so, the government has built 2 hospitals, a surgical hospital and a primary care hospital, with several hundred beds within 2 blocks of our clinic. It's actually a good sign, because it shows that the fact that we recognized the need for a clinic and need for health care in this area was recognized by the government, and they've come in with far greater resources. But because of that, we decided there wasn't a whole lot of work in these 2 hospitals with women and children. We thought we would develop a women's and children's clinic. We found out when we got down there that the government has just announced that they're going to build a women's and children's clinic 2 blocks on the other side of us in that clinic. So I talked with the leadership of the church, talked with the medical folks, and said, look, I think it's time for us just to give up on this clinic, that it's time for us to recognize that the government has come in with far greater resources than what we have to provide basic care for women, children, and all those in need in El Alto. And the church basically is in agreement that it is time to do so. When I talked with Nancy about this, because I know her real heart is with women's and children's work, I think she's come to a conclusion, and we've come to a conclusion, that where we're really needed, where we want to have the biggest impact, for the most impact on women that we can do with the kind of resources that are available to us, we should be out at the end of the road. We should be out beyond the reach of the government in these small clinics, that we can have a greater impact on improving the quality of life for women and the surviving birth, childbirth, and other situations. We can have a greater impact working in those clinics than we can in El Alto, in the cities in El Alto and places like that, where there are alternatives for women to go to. In places like Copique, Marcarivi, Cocamaya, San Julian, the only alternative, the only place where women can get help is at the Methodist health clinics. And so we want to improve and strengthen them. Consequently, now there is a dentist there at the clinic, and there still is a need for a specialty dentist there, what they call specialty, but it would be basically doing fillings and other kinds of things, possibly even orthodonture. And there is a need for that kind of work, so that dental clinic will probably continue there. We might need to do some supporting and helping with equipment. The building is owned by the church and will be used for other purposes. There's already a church meeting in the large room upstairs, and it may be used for district offices. In fact, Dr. Mamani and Lydia, who are the administrators of the medical work, have even talked about moving their offices out there. So the building will be used, but it just looks like it's not going to be used as a clinic anymore. I talked with Dr. Ayala about this, and she was in agreement that we ought to close the clinic. And I said, Dr. Ayala, you realize that if we close the clinic, that means your job is lost, that there won't be any need for your job. And she says, I know that, but I can find another job. I just think it's a waste of money and resources for the church to continue to have this clinic. So we feel pretty confident that we are going to get this clinic closed. We would ask permission from the Brannins Foundation that any money that has been left in Dr. Ayala's salaries, once she finds another job, which we hope will be sometime in the next 2 to 3 months, that any money that has not been paid to her, that was designated for her salary, if we could use it for salaries for the nurses, that would be deeply appreciated and help us to get going on this solution for the nurses' salaries. Also, we want to ask permission to move the motorcycle that is committed to the El Alto Clinic and move it out to Copique, which is the new medical clinic that's way up in the mountains that Nancy visited. We'd like to get that nurse to have a motorcycle. So that would be our request. So we have 2 specific requests of the foundation. One is permission to use whatever money is left over that was designated for Dr. Ayala's salary to go to nurses' salaries. And the second is to move the motorcycle that was committed to El Alto and move it to Copique. Now for the bad news. In 2010, the Brannins Foundation made a $25,000 grant to the nurses and to the work of the clinics. The money arrived, 12,000 of it, 13,000 of it arrived on February 9th of 2011, and the other 12,000 arrived on June 1st. Not sure why it got hung up, but it got hung up at the church at Boston Avenue. In that 25,000, there was 9,000 for the motorcycles, and they spent the full $9,000 on those motorcycles, and you'll remember the pictures they had of it. There was also budgeted in there about $200 for these annual meetings of the nurses, and they actually spent about twice. They spent considerably more than what they had budgeted for that. There was also $6,000 in there for the salary for Dr. Ayala, who is the medical doctor working at the El Alto Clinic, supposed to be working on developing a women's and children's center. She didn't actually start work until about June, and so they only paid about 26,000 Bolivianos, and we had a carryover of about 15,000. That's about roughly $2,000 that was carried over into 2012. All that was fine. We also had about $1,325 in there for salaries, and that money was spent on salaries. Here's where there was a problem. You also gave $7,000 for medical equipment. It was budgeted for medical equipment. There was supposed to be $1,000 for each of the 7 medical clinics to make $7,000. There was also some money in there for continuing education for the nurses of $1,125 and $350 for transportation for the nurses to go. What actually happened was that they spent that money on salaries. the money went into a general Bolivian health clinic fund. And so when the leadership came and said they were desperate in need for money for salaries, the accountant didn't have anything else to say except this money was available, and they used it, even though it should not have been available. I understand why the church looks at things that way. What good is it to have continuing education for nurses and to have equipment for clinics if you don't have a nurse? If there is no nurse out there. So I understand why they did it, but we made it very, very clear to them that that was totally inappropriate. It was a misappropriation of funds. In fact, it's illegal in the United States. That they cannot ever do that again. We had a meeting with Nancy and I had a meeting with the head of medical services and the head nurse, and then his boss, who's on the executive committee of the Methodist Church. And we stressed to them, and I beat on them pretty good. You can ask Nancy. I beat on them pretty good and said, don't ever do that again. That was just totally inappropriate. That if they're short of funds for salaries, they need to tell me about it. But they cannot use funds that were given for one purpose and turn around and do it for another. The good news is, of course, it was not stolen, and I've documented that the money was spent for salaries for the nurses. So it wasn't stolen by someone, some accountant or something. The money went for a good cause, but it's still not what the money was given for, and we had to make that clear to them. The accountant that handles this money works half-time for the church every afternoon. Every morning, he works for Engineers in Action. He works directly for me in the mornings. He works for the church in the afternoon. This has proven to be very convenient for me, because in situations like this, I can explain to him what the problem is, and he can stop and make sure it doesn't happen again. In the 2011 money that was sent down at the end of 2011 and beginning of 2012, we've divided up all of the different line items that we included in the $32,000 you sent. We divide them into separate accounts so that we won't have this problem again. And I'll share some more with you about that later. But we now have that money protected, and the money's going where it's supposed to go. I am deeply apologetic about this misappropriation of funds. It was inappropriate. The church drives me nuts because they don't want to give me bad news on things like we're having problems making salaries. And I'm deeply apologetic, but the good news is we've got it solved, and in our current year, the money you sent down this past year, it's being handled absolutely appropriately. So, and the good thing is, again, it wasn't stolen. The money was just used for salaries instead of for equipment. And I'm deeply apologetic about that, and I needed to let you know about it. In 2011, the Brannins Foundation gave a total of $32,000 for the medical work. This money was, the first chunk of it was received in December 13th of 2011. Is when it arrived in New York, and it came down to Bolivia about 2 weeks later. $7,500 of that went as a grant for salaries, and there was a $325 miscellaneous thing on there that also went for salaries. That money arrived on December 20th, and on December 30th, they sent it out in salaries to pay for salaries for September, October, and November of 2011. And that money was spent immediately. Then there was also $6,000 for Dr. Ayala's salary, and that money was added with the about $2,000 from the carryover the previous year. It totals to 56,108 Bolivianos. They spent about 7,500 of that on Dr. Ayala's her salary, and there is 48,608 Bolivianos in an account waiting to be spent on her salary. And those numbers matched up. There was also a grant of $350 for transportation for nurses for continuing education and $200 for the annual meeting of the nurses. That single meeting that we had in April where Nancy taught actually exceeded that amount of money, and we spent more than that amount of money on that one event. So we're going to, so that money's already been spent. There was $1,000 of Brannins money that was committed to provide helmets for the nurses for the motorcycles. We pretty well discovered that we're going to be able to buy them for significantly less money. But there is also a need for license tags for the motorcycles. Without license tags, you're not able to buy gasoline. And so what the nurses have been doing in the past is they've been getting someone else to go with gas cans in their vehicle, fill up the gas cans, and then they've been using that gasoline for the motorcycles. We think that $1,000 that you have given will not only pay for the helmets, but will also buy the license tags for the motorcycles. And we would like permission from the Brannins Foundation to use this money for both helmets and license tags. And that's one of our requests. The Brannins Foundation in 2011 also set aside $1,000 for each of the 8 medical clinics for equipment and for medicines. They've already spent about $4,000 to $5,000 on medicines using that money, which leaves them between $3,000 and $4,000 for equipment. The original idea was that each clinic would get an even distribution of that, and so each would have an operating budget of $500 or $600, $700, $800, that they could buy whatever equipment they wanted. During the meeting with the nurses, Elisa Kagora, she's the wonderful nurse at Katani, who many of you have seen video on. She said, Pastor, those of us in the clinics that are better equipped have been talking, and we've decided that we would like to recommend that it's not be evenly split between these different clinics, that we give most of the money to the clinics with the least amount of equipment. I said, Lisa, let me get this straight. You've never had an operating budget. You've never had money to spend as you see fit to improve your clinic, to buy equipment, to buy furniture, to buy any other kinds of needs that you have. And now that you finally have the opportunity to have a $700 or $800 budget, you're asking to give up a portion of that, or a major portion of that, so that other clinics can have more equipment. She said, Pastor, they need it more than we do. Pretty amazing. So we're asking permission from the Brannins Foundation to, instead of dividing it equally between the 8 clinics, that we provide it to the medical personnel, which includes all of the nurses, and they as a group decide what equipment needs to be bought for what location. We hope to have that money to be spent before your meeting in late July, and we'll have a list of the equipment that they have bought with that. In addition to these things, the grant included $7,500 for a mobile clinic. That money has been set aside and is sitting in a bank account waiting to be used. And I'll talk more about that. We'll talk more about that when we talk about the request for 2012. You also included in a grant $1,125 for continuing education for the nurses. That's $125 for each of the 9 nurses. That money has not been spent yet. We're going to be encouraging the nurses to register and to sign up and do some training, and go and do training at a hospital or some other registered location to get good training for continuing education experiences. And we hope that money will be spent soon this year. So in summary, we want to ask your forgiveness for the mistakes that were made with the 2010 money that went for the salaries instead of for the equipment as it was supposed to. We also want permission to use the money for the equipment for the clinics to go to the clinics that are in the greatest need. We also would like permission to utilize the funds that will not be used for Dr. Ayala's salary to be used for nurses' salaries. Otherwise, we'll be returning that to you, which is also, we can do that if you need. We'd also like to use the money that will be left over from the purchase of motorcycle helmets to be used for license tags for the motorcycles. The funding from the Brannins Foundation has been a true godsend for Bolivia and for the medical clinics. If it wasn't for the Brannins Foundation and the money that went into helping with the salaries, we would have closed probably virtually every one of these Methodist health clinics. Up to 10,000 people would have been without medical care over the last year or two, and the Methodist Church would have had a really black eye for the fact that it had closed these clinics. The only reason we were able to keep them open was because of the support of the Brannins Foundation. Now with the purchase of the motorcycles, with the 2011 money now going for equipment, medicines, and continuing education, we're beginning to see the upgrades and the quality of the medical services that are provided by these health clinics. But I just want to give you my deepest, heartfelt thank you for the incredible gifts that you have given us over the last 2 years. It really has made a difference, and it has saved lives. Mother Teresa said, "Whoever the poorest of the poor are, they are Christ for us." Christ in the guise of human suffering. Your support has meant a world of difference to up to 10,000 of the poorest of the poor in South America. It has allowed them to continue to have access to medical care. It's kept these health clinics open. Your support has made a difference. And I just want to say thank you. And Dr. Thompson and I will get an application to you for 2012. Thanks again. Sorry this was such a long video. Thanks.